Oh, oops.
Hi, everyone. We just had a very long conversation with ourselves, but nice to have you all here. There's 36 of you on the Zoom, and there's about at least 15 or so in the room, so well, maybe 10. So thanks for being here. If everyone can mute themselves, and we're going to, go through a couple of things. Thanks, Patty. And if you have any questions as we're talking, just either go into the chat box and ask your question, or send either Jeannie, Leslie, or Dahlia a click, and then she'll bring up the question. Because we want to answer questions today, so we left a little bit of extra time because I'm sure people have some issues. But I want to congratulate everyone and thank everyone for doing such a great job. Home health is really doing amazing so far. Of course, we have our glitches and some things that need some tweaking, but overall, everyone's doing a really great job. And I just want to remind everyone that the care that we provide isn't changed because of the way that we document it. So everyone still continue doing the care that you do and providing great service, and then we'll figure out how to chart it all. So with that being said, I'm going to get started. I wanted to show everyone how to add a home health aid care plan. Because that's been a little bit of a tricky thing. I'm gonna pull up a patient. Bar doesn't have one. Do you have? Flattery has one. Miranda. Okay, thanks. This big one. Yeah. So when we need to do a home health aid care plan, the way that you're going to do it is you go to the orders tab. Well, one, you can call your PAS, but I want everyone to know how to do it themselves, just in case. You can't get a PAS, and it's not hard to do. So here on your patient, you're going to go to the orders tab, and then you see the 485 with the pencil here. So I'm sorry. I didn't mean to do that. Well, since I'm here, I'm going to show you what everyone's been forgetting. Well, not everyone, but this is a new thing to everyone. When you're in the 485, you must hit save and close. If you don't hit save and close, it gets, in quotes, locked down, and then no one else can access it. So then if you need to get in, someone else needs to get into it, they need to click a director to say, can you please unlock the locked 485? So please, everyone, whenever you're in the 485, and I know like this is what you see, and you're doing your typing and you're clicking, and you just want to go up and get out, and like maybe just go to the back arrow or just just leave it. But if you just leave it, like so here, I'd say, oh, I'm now going to go someplace else. Well, then this gets locked down. So I know it's a little bit of a thing you have to remember because it's so far down, but please then hit save and close. This was actually on the agenda to talk about save and close, so we just went a little out of order. So now I'm going to go back to how you add a home health aid care plan. So you use the drop down arrow on the 485, and you do here attach care needs. You're going to select a date. So I'm going to select today's date, 12. And the discipline, this is the piece that's been a little shaky maybe. People are picking RN instead of home health aid. So when you go here, you have to pick home health aid. Now it's going to go to this window. And when you put in here home and search, up comes this one here, home health aid care plan. I entered this and I forgot the E on aid, and now I can't get it. So I'm going to figure it out a little bit afterwards, but for now they're going to be spelled with no E. I'm going to pick home health aid care plan and hit save. And then you go down to where the care needs are and see how it says home health aid care plan, home health aid. If under the discipline it said RN, it wouldn't show up in the home health aids service note, and then they don't know what to do. So you must make sure you choose home health aid, and this is the one that's created for Livingston. And then you go to just like you do for the other care needs, we're going to add goals. And we have only one goal. It's a very long wordy goal, but it matches what we're supposed to have with conditions of participation. So you're just gonna pick this one goal and hit save. You don't need a start date or end date because you're just gonna have this, you know, throughout the episode. And then you're gonna add interventions. And now these are all the things that the home health aide could do for your patient. So you want to go in and pick, you know, whether it's bathe in the bathroom, sponge bath, a bed bath. Now there's one on here that just says shower. It used to say assist with shower, but people just wanted shower, so we changed it. Then apply lotion, deodorant, turn or reposition, use the gait belt with prances and ambulation. It's important to be kind of specific on this care plan. As a reminder, Joint Commission's coming in a couple of months. And the last time they were here 3 years ago, this was something that we got written up on, that we didn't have. Our home health aide care plans were not specific, and they did not provide instruction on safety. So that's why I use the gait belt. You also want to choose verified patient using 2 identifiers. You guys have seen that in your service notes where it says, how did you identify this patient? And you pick usually name or date of birth. The home health aides now know to do this as well. There's things in here: report increase in pain to office, report any abnormal findings to office, remind the patient to take their medications, to do their home exercise program. And the reason we put pain to office or no bowel movement to office rather than the case manager is you usually can always get in touch with someone in the office, and someone in the office will figure out then and triage then what needs to happen. So that's why we chose to put to the office instead of to the case manager. So please pick your interventions that you want. And then hit save. And edit goal description. You don't really need to edit this one. I just wanted to show you because it's not in a number of visits. It's throughout the episode of care. It's really worded the way that you need it, so you don't need to edit it. Like, you know how some of the other goals we edit. This one you just keep the way it is. Okay, so now when the home health aide would go out, she or he would have their care plan. It would show up on their device, and they would just be able to mark completed, and it would be good the way that it is. Any questions on how to do the home health aide care plan? I don't see anything in the chat. That's very good. Leslie's asking if there's a spot for weight bearing status or to keep wound covered. So to do that, you could do in edit goals. Oh, no, not goals, sorry, edit intervention. There is a spot where we could add.
We could add one.
Right.
Wait.
Okay, we'll, I think there is one. Okay. I'll look into that, and I'll let you guys know on our next meeting about where you can enter that information. I know there is a spot, but.
There's a spot you can enter
A custom
special
thing.
things.
Yes, there
Okay.
is.
Yeah, or you can always add something, delete it, and
Oh,
add what
is
you
it
want.
here? Edit intervention. You can always edit. Okay. All right, so we always learn something as we do this, so thank you. Oh, there's a chat question, let's see. When it's time to modify the care plan, how do we do this? Okay, great question. And that is when you would go into it from here down the care need, and that's when you would do just what it says here. You wanted to add interventions to something that you hadn't chosen before, that's what you would do. You go into here and you do, now you wanted to do this, but let's say you had bathe in the bathroom. And now someone calls you and says, you know what, they're ready to do a shower. You would go in and you'd end date this for the day that it would end. So let's say we chose, well, we started this today, so I have to end it today. And then you'd go in and you'd add shower. You go down and you'd find shower. And then you'd put a start date, the day that you wanted that to start. So I'll just pick today. Okay? We have another question. I've not found a spot where you can enter any special instructions, so I've been adding it on the shower intervention. That was from Jennifer Duchesne, and, okay, there's a spot where you do, what'd you say?
She would just add
But to add a custom one is what she does.
Yes.
Where you put the weight bearing or something.
Well, you can just edit one, so you could go into the shower, you could edit that.
Right.
Shower, comma. Maintain, and put your special instructions, or we can add a special instructions.
So you go
choice.
here, shower. Patient is non-weight bearing. Keep wound dry. Cover with saran wrap. Whatever you're gonna say. So you could do it there, but I will add 2 custom spots that will be blank that you could put extra items in there. Okay, let's see what other questions we have on this. I think we should add fall risk too and DME. I thought we had fall risk, but Jennifer's right. You're taking that note? Okay, we'll put that on there. Thank you this is excellent. This kind of feedback is exactly why we do these meetings, because sometimes when you're in the thick of it and doing it, I can forget, or we all can forget. So thanks to that, we'll put in 2 custom ones. And we'll add the fall risk, which I thought we had, but I didn't read through them all. Okay, any other questions on the home health aid care plan? Okay, now we're gonna go to discharging a patient. Is that what you're saying? Oh, great. So we have a live patient of Alex's that we're gonna go in and discharge. Trevor, CHE. So I want to thank all of you for your great feedback. Lisa Vincelette last night was doing some discharges and she said, Jamie, I'm ready to discharge my patient, but it still hasn't been coded. So on this one here, this patient also hasn't been coded. So we don't want to actually send out this discharge summary until we get it coded. Just so you're all aware, we're down 1 coder. And so Keena's been doing all of our coding and she's been very instrumental in helping getting Care Efficient rolling out the way that it needs to. So we're definitely behind in coding. Keena with the other PASs will be working this week to get everything as up to date as it can be. But as you see here on this example on the primary diagnosis, this is the code that you guys are all putting in just to get your record to an approved status, this A00.0. But we don't want to be sending things out to the doctor with this diagnosis on there.
Mhm.
So we have to be
So we have to
careful.
wait until it will be coded, yeah?
Yes, we're gonna wait to send it to him until it's coded. So please, when you guys are doing this, if you guys can notice that, and if it's not coded, send me and Keena a click. And we'll get them, Keena's been working way over time and doing tons of stuff, so just we need a little bit more time to get everything coded. But Alex wants to go out, he's gonna see this patient. Did you already see the patient for the discharge?
Let's okay, right, yeah, she's ready
Okay,
to
so
be
this
discharged.
patient's discharged. So Alex knows the patient's gonna be discharged, so this is the process. We went through this last week, but little things come up every time we talk about things, and obviously we can all forget little pieces of it. So we thought we should just go through it again. So I want to show you guys now what the patient's orders page looks like. So you see here, we have a 485 case communication and case communication note. Once we put this patient in a discharge status, you're going to see a new line here that says discharge summary. So I'm gonna put the patient I'm gonna click discharge patient. And you must do this in order to get the right OASIS and the right service note. So the reason for discharge is, are they discharged to home or self?
Mhm.
Okay. The discharge date was when?
7.
Order type, you want to pick discharge summary form. So that this creates what you're gonna see on this orders page in a minute. And then you hit save. Now you see how this is here now, this discharge summary form?
Mhm.
Okay, that's there, and once Alex completes his discharge note, it's going to populate this discharge summary, and that will go out to the doctor. So I'm gonna show you what it looks like. Alex didn't do his charting yet, so it's not gonna be fully populated, but just even without Alex doing his note yet, you'll see what the doctor's going to get. Then I'll show you the note and what populates. So right now, this is a discharge summary form, because there's a fax, we'd be able to just fax this, right? Alex would just be able to go in and fax it, but we're not gonna do that part today because we have the wrong diagnosis, so we're not gonna actually send it. It's for this patient, it's the patient's phone number. This is the doctor where it's going to. The referral source came from St. John's Valley Hospital. The discharge date, and we discharged to home or self-care, would have been the diagnosis, and it populates with the disciplines that we're seeing this patient. In this case, it's just SN. Yeah, I'll show you a different one that has more disciplines, but here we'd say the orders, well, how come the medications didn't come on here? Do we not have medications on this patient? Let me check. Well, I'll pick another one that has more information in it. Because it has all of the, we have no care needs on this patient?
Maybe it doesn't populate.
But anyway, let me close this one then. I'll show you. Yeah, all these care needs are on here. I'll do, who should I do?
I'm trying to look at one of these.
Okay, that's a good idea. When I go to.
Later.
Okay. When I go to, no, these are so helpful. When you go to service notes. Oh, Alex would have to go to his service note now and do it. Okay, let me pick another one. I just really want to show you guys the discharge patient, and it's showing up on that orders page where it has this discharge summary. Now I'll show you one that gets populated.
So right after this one, they would actually go to their calendar to open up the note.
Yes, yep. Yep, so Alice would then, he'd have then the correct note in your, if you probably go into yours now, you'll see, Alex, you'll see that when you go to do your discharge note, your service note, it will have what you need to chart on. And it'll give you what OASIS to pick, et cetera. Okay, let's go to a different patient that has, that Lisa Vincelette, I think did. Slater, right? SLAT?
Yeah. Oh, probably the discharge status.
Oh, right. Okay, so here's this patient, Slater. I'm gonna go to him. We'll go to his orders page. You see the status is discharged. Up here, the status is discharged. We'll go to the orders page. And here's the discharge summary. Lisa got it to an approved status. We need to tell medical records not to, oh, is this one coded? Oh, good, this one is coded, so it can go out. Okay. So I'm gonna show you what it looks like. Okay, so here's Eliminate Home Health, the TIN office. It's for Dennis Slater. It goes to Dr. Mary Ragsdale. The discipline that was in was just PT. The start of care, patient's date of birth, the cert period. These are the orders that Lisa had for this patient, 2 times a week for 1 week. Then another 2-week one and a 3-week one. And here's the medications. They all just, Lisa didn't have to do anything to get them here. They just came on over from when she created this summary form. This is Lisa, her approved date is today. And now you're gonna see the care needs that Lisa had for this patient. Goal description. Now, Lisa, I think you're on this call. Did you meet these? Okay, there's a lot in the chat. I'm going to, so these core needs, if you mark met, it populates over here. Like here, Lisa had this one that says not met. So this was her care need for total hip replacement. She said in 7 visits it's in process. This one's not met, this one's not met, this one's in process, this one was met. Lab data she put in her service note for this visit. There's a page, it's called V2 summary. I'll go and look at that. She populated that with not applicable, the lab data, and that came onto the summary. She said the patient's discharge condition was excellent. None of this did she have to fill in on this form. This automatically populated from her service note.
Scared
Let me-
son on that fart.
What's that?
They need to meet
Oh,
themselves.
okay, they didn't mean to talk. I'm gonna open up the chat and see. Oh, can't see, oh. I needed to share my screen. Oh my gosh, I'm so sorry. Reshare.
You gotta stop first, hold on.
Oh, Jennifer said we can't see and I didn't grab it. That was at 8:50.
I'm sorry, you guys. Can you guys see it now?
That was just 4 minutes ago, so it wasn't.
James, if you can remind me of things like that, because I'm not gonna remember.
What's that?
If you can remind me, if I'm doing this, if I'm forgetting.
So when we,
I see your screen,
Oh, you do?
yeah.
Oh, okay, they can see it now, okay. Sorry about that, guys. I'm not this Zoom thing, I'm getting better, but still. Anyway, this is what the discharge summary populated. And it populated without Lisa having to do anything on this. Everything that you see here just came onto it from her service note and populated the whole summary form. And now this will just go right out to the doctor. So there's no longer that you need to contact Anna Baker. You don't need to, you just do your service note and it populates. I'll show you what Lisa's service note looked like. And I'll show you where it is in your discharge note. Okay. Can you guys see this? And now I need to change again the screen.
Sharing.
I see it.
Okay, let's see what they said. Yes, okay, they can see it. Okay, so discharge from agency, I'm gonna just open up her note. So this is Lisa's service note. I'll get to the page where it exists, the discharge summary. I hope you can see that. Okay, it's near the end.
You can see that, James?
Yeah.
Okay.
Here it is. Discharge summary V2. So Alice, this is what you'll get in your note. And when you answer these questions, this will populate onto that form that I just showed you. Where is the spot called lab on here? It usually says lab and she had to say that.
There's second one down.
Right here, lab data. So for therapists, this one, you'll usually put NA unless you know of the nurse's lab data. Okay. Someone's texting me now. We can't see the screen. Is that still old now?
Again.
Okay. Can you guys see the screen? Someone can unmute themselves. Can you see the service note?
Yeah, we're good.
Yes.
Okay, thanks. So this here's the discharge summary. This is what Lisa filled out and that's what populated that form. That's pretty much what I wanted to show you guys. And to make sure that you fill out all the area in this discharge summary when you're the person doing the discharge from the agency. Okay? I'm gonna close that. And now the next thing we were gonna talk about was take this missed visit from calendar. Oh, aren't you doing that?
Yeah.
Right. Okay, I think I'm done, which is a great relief.
Are we sharing the right screen now?
Are we sharing the correct screen?
Yeah.
Okay, you wanna sit here? Or I guess. I
What's,
can-
oh, Jeannie says she's doing it, Jeannie.
Oh, you're gonna do
Yes.
supplies?
Uh-huh.
Okay.
What next? I don't think I need that. So you guys currently, what had happened in McKesson was, our patients in McKesson were linked with the McKesson supply manager. So it was pretty easy for Yvonne and Catherine to, order supplies in that system. All that information flowed over to the supply manager. But currently now with our care efficient patients, we don't have a link where those supplies can be ordered. So right now, while we're working on this, when you need supplies for your Medicare patients, get them out of the supply cabinets here in, in the different offices. But please remember to fill out a supply form. If you don't fill out that supply form and get that to Miranda, we can't bill the patient's insurance. Those are for Medicare patients, Gold Coast patients, those we're still ordering through Edge Park for those. So, and then you don't need to, where is that place where they can, there's a place, yeah.
Okay, we have a question, we'll go back to that.
Yeah. Okay, so there is a place in the patient chart where it says add supplies. A few nurses or clinicians were asked to fill this out. What supplies you used at the patient's home. For now, we will not be using that section in the patient chart, so you don't need to enter supplies there, but what you do need to do is put a note in the service notes with the supplies you need, and then send a click to Yvonne or Catherine, who's ever ordering supplies, and telling them to please look in the patient's chart for the supply note. So you see right here where it says add supply, can they see the screen? Okay, you don't need to fill that out right now. We will keep you informed as we move forward with when that will need to happen. Are there any questions on that, on the supplies?
But show them where you do need to put it in the chart.
Oh, yeah. So you do need to put it under notes.
Home. Okay, I'm just gonna try home. Oh, yeah.
When you're in the hot seat, you don't think it's clear.
Yeah. Are you saying I'm not thinking clearly? I'm perfectly clear.
You're doing better than I can do. So in the notes tab is where you would put the note to the scheduler with the supplies that you need. You just add a note and,
Let's see, what are we gonna pick from? General?
Yeah.
yeah, general is usually what you choose.
And then,
Is this where you have to add the patient's name?
No, this is in the patient.
Okay, yeah. And then you just list, just like you would when you sent a case communication note to your scheduler, you would just list the supplies that you need. And then you click save, and then you can click them right after this to tell them to look in at the note for this particular patient so that they can see what supplies they need to order.
Right, because remember, these notes won't automatically go to Catherine or Yvonne. This just lives in the patient's chart that anyone can view this. So that's why you need to make sure you click Yvonne or Catherine and say, please see the supply note that I entered into Princess Flannery's chart. So then Yvonne and Catherine can go in there and see the supplies that you requested they order. And again, like Jeannie said, they're gonna come to the office and then you'll have to get them and fill out the
supply form, yeah, those supply forms that are in that holder on the wall in the offices that you guys are familiar with. And then just make sure it gets to Miranda.
And this will, all in about 30, Molly said, 30 days is the least amount of time, 60 days should be the most amount of time where we'll have to do this process. It will be integrated and we will be able to, again, have the supplies delivered to the patient's homes the way that you're used to. We just need to do this temporarily.
And then one more thing, it's a good idea to keep some of those supply forms in your trunk supplies. That way, if you use any trunk supplies for a particular patient, you'll have one of those forms with you, you can fill it out, and the next time you come to the office, you can give it to Miranda.
And this applies to therapy staff, you know, you guys do have those patients that, we give out island dressings. We occasionally will do a dressing change on our ortho patients. So same thing applies. Have some trunk supplies. When you get them from the closet, you should indicate you're taking them out as trunk. If you know you're pulling out 4 island dressings to give to Mr. Smith, you should fill out, you did that. Or when you're coming to replenish, you should have some few of those forms in your car, so you can quickly fill it out that day. It's easy, 5 days later to forget.
Well, this is a good question from Monica, and I don't know what the process is yet. Because it used to be that they would put in the case communication note, the schedulers, when they did order the supplies, so you could look there and find that out. So we will figure out what we're gonna do for this process. moving
I
forward.
And just to click back. So we're clicking Yvonne to do this, click us back when
Yeah,
she's done.
okay, so
And they
we'll,
should enter a note.
yeah, we'll instruct Yvonne and Catherine to send you guys a clip when the supplies are ordered.
And we'll have them enter a note in this notes tab, like you guys did. They'll go into notes and they'll say supplies ordered and the date that they ordered them. And that way they will keep track of this process. So after Yvonne and Catherine order it, they'll go in and put a note and they should click you back. If they don't click you back, when you're in your patient's chart, you'll go to notes and see, did Catherine or Yvonne order them? And Alex has a question?
Yeah, my question is, if somebody occasionally forgot to put note in start of care lab, like I go through start of care and I forgot to mark notes for supply, and I click approved, it will be sent to IT department for review. If I forgot how to do it, if I forgot to mark note with supply, and I already sent note to PS department, how to do it? How to order supply?
Okay, the supplies and PAS don't go together, so,
So
You can
I
send it
forgot.
at any time.
to add supply.
oh, you
I
can
go
use,
to the chart and click approved, it will be sent to PS department. I cannot open it anymore. So how to order supply in this case?
okay.
The notes in your charting are separate, so you can add any notes
So
for
just
supplies at
send
any
note
time.
to the.
Yeah, you can add it at any time.
Okay,
So this notes tab, Alex, is what we're talking about, not your service note.
Mhm.
So when you need to enter a note into this patient's chart, you go to the notes tab and you hit add note.
in supply. Okay,
Right, and then you put the supplies in here.
okay.
It would be independent of your service note or anything else that you did. The two don't talk to each other. Okay.
I thought it was collected with patient chart.
It is connected, but it's not connected to your service note.
There was another.
Oh, something about labs, there's a question. Zan had a good question. So Zan had a question, if we were to put the lab, if the labs were done for the patient, do we add all the lab results we got on that one?
I'd like to say no for right now because the lab results should have went to the physician. So I think, I'm speaking on the fly, but do you think they should say,
I think we just do weekly CDC, CMP done.
right? I would keep it short and succinct. If the doctor has questions, he can call us or she can call us. I think it's just a spot where you indicate that these labs were done. And then it's giving him a heads up and he can ask for information afterwards. But that's a good question too. Thank you. Okay, so now Leslie's gonna talk about missed visits.
Yes, okay, so, and I wanted to show you guys one other thing that it's new. So, see this visit here, how I've got, remember me, I like my Zoom. So if you look at your calendar, see how this visit here on the 29th, if you can, to me, that looks green, that paper. That's an approved visit. That visit is completed in an approved status. These are not, so they're orange. So that's a quick check for you guys to look at your look at your schedule. Like, ooh, I gotta get these to approved status. Obviously, these are my fake patients, but so just when you look at your calendar, this is an enhancement that's It's only been a couple of days and you might have started to notice it. So there, the color means something. Means it's completed and an approved status means, you know, in process. Okay, so last week we talked about how to create that interim order for a missed visit and how you create that document that gets automatically faxed to the doctor's office once it's in an approved status. Well, there's a way that you guys can do that for your patient that you arrive and you know, you need to send that. There's a way to do it and pull that visit right off that patient's schedule. So I'm gonna go to little Flannery. I want to get into this patient's schedule. Okay, and this is something, I just pointed this out to a clinician yesterday. If you just, you know, how do I know I'm the last one out? How do I know who the nurse is on the case? How do I know who else is seeing this patient? You know, there's the status where it's nice and tight, but you kind of don't, it's not a very good example. But it shows you what type of visit, who's assigned. Let's just do a real patient.
They can see this, right? James,
What's that?
seeing this screen?
I'm sure. Says it's sure.
Yep. Okay, so just so you can see
Yeah.
a real patient, you're gonna go to scheduling. So lots of visits. If you want to know more, I showed you guys this last time. So you can see, obviously blue were verified, but you can see what's going on. Okay, Monica's got a revisit, Julie's got a revisit, Lauren's going here. So you can really see what's going on. So just,
It takes the place of when we used to have those paper calendars in patients' homes, but here it is in live time.
Yeah.
You'll see that the home health aide is in. So this is, you know, you go to the scheduling tab on this patient, you know, to get to here.
okay, so now, yeah, so you see right here that, well, this is a patient's chart, but anything in blue has been verified. That means Monica got paid for that visit, Julie got paid for that visit.
Or will get paid in that patient.
Well, yeah, it will,
Have to be daily paycheck.
it'll make it, yeah, no daily paycheck. It'll make it to, you know, it'll go through the payroll process on payroll Monday and it'll end up in your paycheck that Thursday, Friday. So, actually, Julie, not sure what happened here, but but the process is that behind the scenes, Jamie and Barbara in payroll verify these visits. And it's just a matter of, she might do a bunch on a Tuesday afternoon, and then she might not do it again until Friday. So just be patient, but you should see them as things, you know, as time goes on during each week, they slowly get verified.
And today I'm gonna do a bunch of them, but this is the perfect time to go into this because of verifying visits. I clicked a couple of you, then I went in to verify and I saw there was no note. So in the verifying process, any visit that's on the patient's calendar, regardless of whether it was done or not, comes over to get verified. So for example, on this case on May 4th, when I go, there's a green visit by a PT that this visit hasn't been opened. So then I don't know what to do with verifying. So then I have to go to this calendar of this patient and look to see, and then I'd have to click the clinician. Did you in fact see this patient? If you did, please make sure you open your visit. If you didn't, please go in and put a missed visit note. By putting in the missed visit and creating that order, it will remove it from the patient's calendar, which that's what Leslie's going to show you.
Perfect segue.
Yeah, we need that in real time.
And this is a neat trick, you guys. I just did the back arrow right here and I just, so it just helps with navigating if you want to go back to the screen you were on before, because a lot of times you feel like you got to go all the way out and go back in, and so use the back arrow. Okay, so I have this patient here and Friday, I went to see the patient. She declined, end of the week. So this does affect the frequency. I need to send a missed visit note to the doctor. I'm not working
You can
Saturday.
reschedule on Saturday,
I said I'm not working on Saturday.
but if somebody else.
If there was an urgent need, Alex, then you could ask the scheduler, please move it to Saturday and
Yeah.
assign to another nurse or assign to another
Yeah.
physical
Yeah.
therapist.
On
Patient does
Saturday,
need.
it's not patient,
Yes.
then you need to send.
Good point, good point. So, But in this case, the patient said, don't come Saturday, I'm having family over.
Okay,
So we know it's a true missed visit. So you're in the so you want to be in the patient's schedule, okay?
So that was Leslie's schedule. Now she's in
Now-
the patient's schedule.
Yes, that was my home calendar. I just had that one patient. So from here, you're going to hit cancel, okay? And I'm going to say patient refuse service. I've got to change the date to 30th. Patient declined PT visit today, not feeling well. Right here, you guys, interim order. You do that. You hit confirm.
go back to the order.
Look, it's gone. It's removed, so it's not a, here you don't have to let Kathy know, remove the visit, I notified the MD. So I'm not done yet, but I've taken it off the patient's calendar, it's off my calendar. And now I am gonna go to the orders, because that created the missed visit note right here.
I have a question for you.
Right there, I know, hang tight.
Yeah.
So,
And you can see,
so there it is. So see, you guys, it populated what I entered already, and it populated the service date. Okay, and then I'm gonna do sign. Because it's not gonna get faxed until I do sign. Sign,
And approve.
excellent, approved, okay? Now, I have a feeling I know what Rick's gonna ask. Is it about the not home, not found thing?
Correct.
Okay, so,
Wait, show them on the orders tab that now it's in approved status. There it is. And now medical records is mailing things out or faxing things out between around 9 in the morning and 3 in the afternoon. So anything that gets to an approved status, it's gonna leave our building almost every day, twice a day.
yeah,
So make sure when you have something in approved status, you're good with it because it's leaving the way that you have it. So yes, we need lots of things to get to an approved status, but approved, means a lot of things. And in this case, on a visit like this, it means it's leaving the building in a couple of hours. So,
I just wanted to point out, if you look at, if you're in your patient's chart and you see a lot of saved notes that are saved, those have not gone out.
yeah.
So if you know that you wanted that note to go out, make sure you go in there and approve it. I mean, I know you
That's-
forget sometimes, but if you're in there, just, look, keep your eyes open and look to make sure they're approved.
but.
It'll probably end up. These kind of things, but we're not gonna talk about Progressive. Okay, so Rick, I know, so,
Oh, wait, there's 2 chats before you answer. Let's do what Rick wants, but let's see what the 2 chats are. Or do you want nurses to put IV dressing change or is it sample weekly take care? We'll answer Keener in a minute or two, because that's a little bit off topic. Is patient in the doctor's office and that's why you missed visit, do we still have to do an interim? Yes. If it changes the frequency, even if it's because the patient's going to the doctor, we absolutely need a note to go to the doctor to let him know, because it changed our frequency.
and look, a note was when this, a note will populate. I don't know why it's not there yet, but when that fax gets sent here's one that I, see, this is.
Yeah. Dr. Amy Jones is good.
Dr. Amy Jones might have gotten a few things about Princess Flannery. I have to call that doctor's office.
No, okay, they're not.
They're not.
If they catch it.
Okay, so anyway, but this is what it looks like, missed visit, the date, and when, and who it was faxed to, and it went through successfully. So that will, once the fax goes out, that does, Maria Miranda, she's in medical records and she's in charge of sending these out, these mass faxes twice a day. So, So the other piece of the puzzle was I needed to get paid my not home, not found for knocking on that door and having them say, you know, and we went over that last week. So, and then the mileage. So,
Show me again.
yeah,
In a few minutes.
so we've got,
Patient,
the thing is, they, hold that patient.
non-billable visit. If somebody visit patient and knock the door, but patient refuse from this visit. But
That's-
you try to visit patient, but unsuccessfully. How to,
Not home, not found? You
Yeah.
talking about?
non-billable visit. How to
Well,
right.
create it.
We call it a not home, not found. So you
No,
get,
no, it's homebound, but for the
I
patient
just-
refused.
Right, we understand the patient actually is home,
Mhm.
but it's still called, it's either not home, not found. It just means a non-billable visit that you only spent a little bit of time on.
That's it.
And the only reason I'm emphasizing that is because that's the code you have to pick. So
So we're gonna
Leslie
go
will
for that.
show you right now how to do
okay,
that.
so you go to your homepage, your pay, that's a pay only code, right? It's not
Probably yes, pay only code. yeah.
pay only. So you go to pay only.
Mhm.
Agency, I believe that patient is in training. The patient,
Patient, mhm.
she is the associate me. And my service. Right there.
Mhm.
And the date,
Show them how you, why you should pay. So if it was Alex,
oh, it was
It
Alex?
doesn't matter, but I understand. Mhm.
Okay, so but how to find yourself, just those are shortcuts, you know, enter the first and first,
oh, well, I meant those, yours would be called SN dash not home, not
Mhm.
found. See, ours is called PT,
theirs is actually
Oh,
RN. So if it was Alex,
RN not home, not
Mhm.
found. Okay?
Time in, time out, and short note, yes?
You don't even have to
No.
put a time in,
No
time
time
out.
to short note,
no, well,
In
you
this
can say
comment, yeah,
right here.
that's
time and
um,
short comments.
Patient declined visit heading out to
Got it.
MD office. Now issues with catheter, whatever, blah, 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 whatever your declined visit was. And then you're gonna, schedule continue.
Oh,
Okay, fake patient, doesn't matter. Now, there's the whole thing of,
Mileage.
mileage. Still sitting on it. So then,
Oh, it says not home, not found. Go to my house and you say it will show up,
But because
okay,
you're,
there's a not home, not found.
right?
So now we're gonna go and we're gonna do our mapping for the day. And there she is.
Oh, the
30th. 30th. Good point. All right. She's on every day. I see her every day. I love her.
There she is.
Okay, right there. So you guys, this is great. Rick, this is answering your question and
well,
I'm learning this on the fly.
yesterday when we did this, we couldn't find, after we did put the missed visit note in, it took the whole thing off of the mapping.
We did it the old way. This is the new way. This is brand new. I figured this out yesterday afternoon.
After we did
This
our.
is hot off
first
the press.
Yeah, when we were doing your stuff is when we figured it out, like, oh, this is a better
Yeah.
way of doing it.
Okay.
Yes, so
Okay.
So you guys, this changes how we taught you last week. You still end up with the same document that needs to be approved, or sign, approve, you know, lives in the same place on the orders tab. But the way you
Access
enter
it.
it, the way you enter it is in the patient's calendar. You cancel the visit, you put the reason, here, we should probably go over that again. Okay, you guys know how to do your mileage. If you don't, call me. So let's just do this one more time. So you go to your patient schedule. Click on the visit. You hit cancel. This applies to any discipline. Patient review service. The third. Visit when PT arrived. Interim order, confirm, don't put anything else, and then you go back into that. You want to get to the header page, get to the order section. There's a new one, that's it, missed visit. Visit was on the 3rd, so we're back to where we were. Okay, so,
And now go to the mapping and you'll see that it's there.
right, and now we're gonna go home. We're gonna go down to mapping. And when I put 5.3, maybe it needs a little time.
Needs a little time.
Must need a little time because it did populate for that other one. Right. So sorry, on the fly, that didn't. So call me if you have any questions, but I really, okay, and I think that's, oh, you guys, IT said they've only given out about 10 or 15 mice, the mouse that attaches and syncs with your tablet. So please contact IT, come and get it. It's really helpful. It's really helpful when you're scrolling and looking. You're in a patient and you're looking at their meds. You know, it's just, it gives you more functionality than the touchscreen. Because when you're on a tablet, oh, there's not a bunch of meds. You know, there's times when you want to scroll up and down within like a window or a box, and it's a real struggle.
And when you do get that mouse from IT, you want to go to these,
You know, go ahead, yeah. That was a
go to
good
this
idea.
here. Oh,
Here, I'll show you.
okay, you do it.
You got hit stop share at the top.
It's a setting.
All right, so inside, once, this works good whether you have a mouse or you're using the pen or your finger to scroll up and down. You click on the three dots in the upper right-hand corner and you choose desktop site. What that does is that instead of using the mobile.careefficient.com, it uses the full like computer website. So it allows you to scroll up and down a little easier, both with your finger and with the scroller on your mouse.
And I was told it can help with copy paste.
You mean like copying text and pasting?
Yeah. That makes,
I would imagine so.
yeah, that's what Doug mentioned to me this morning, that
And especially like if you're trying to drag and drop, like right here on your schedule, you're trying to drag from, from Wednesday to Friday, your visits. If you don't have the desktop site enabled, it's very, very difficult to use.
And we did have a question about the color coding of when you're in your, can you give it back to me, James?
Yeah, I'm just,
The color coding that you see when you're on your.
all right, so you want to go to, like, in a visit, yeah.
See here how we showed you guys this color coding? Green's the page is done, red you need to go back, black hasn't been touched yet. And you see this when you're in the desktop version, but on your tablet, you guys aren't seeing these different colors. IT is working with Care Efficient to figure out what's going on with that. It should be able to be fixed. So I think it was Mark Whitman who asked that question this week. But just when you're doing your QA review, it will always say response required. So you'll know you'll have to go back to that. So look for that for now when you're on your tablet and you can't see the different colors. Okay, are there any questions?
I have another question
Okay.
on something. Could you please go over again how to go back and review a previous note? For instance, if I'm covering somebody who's on vacation, I want to see their previous note.
Okay, so let's go to, there's a ton of stuff on this, gentleman. So you pull your patient up, you go to the view patient encounter, you're gonna go to service notes. So let's see here. So, great. So, Rick's gonna be doing the next visit. He wants to see how things went with Julie's visit here on the 6th. So you're gonna, when it gets super busy, I think it's nice to click on that line so you know where you're at. and you're gonna go to the drop down. You guys don't have as many choices, so you guys, and you're gonna wanna,
Full service.
go with full, because that way, if something didn't get filled in, you know it, you know where it's at. So he can see what she filled out and her comments on the task actions.
When I hit that view full service node, is that going to download like it says, the complete
So-
download every time?
Do you guys wanna have, you wanna do it on a tablet? It's a little easier on the desktop because it just pops up. You have to go to, so if we can, so let's get a tablet.
Well, we'll transfer it back to James. James, you can do that, right? Show them. Because so Rick's question, because I don't know if you guys could hear it, we're operating right now off of like a desktop. When you guys are on your tablet and you go to view a service node or any of those printer versions where you wanted to see what the 485 looked like or what the PDF version of the order is, it asks you, do you want to download this? And I
What
think
patient
it
should I use?
goes to
Mulhart, same patient.
How do you spell
It
it?
actually won't let you
MAUL.
if you don't download it, you can't see it.
Right, you have to.
You have to
Right.
download.
So James, yeah, so,
And then nurses, I want to address one last thing with you guys too.
and then just scroll down.
Is any one of these guys?
Just the last one, the bottom PT one, just let's go where we were, so,
Just,
One right
one above it, one above it. That one, and click full, view full.
This is what you'll see when you do that.
Okay, so it did
That would
put
be
right
me.
up.
That's not what I did see.
Mine doesn't work that way either.
you can print the desktop site. And you're using the PC version, not the.
Oh, so unclick it. Will you unclick the desktop site just so they can start?
I will. This guy.
So all more reason to use the desktop site, but
And you see how it kind of, it'll reload your screen in. For you.
Yeah, that's what I see.
Right.
so
So generally, you would just click download here. And it should automatically open, but you do have to click download.
Right, okay.
And sometimes,
You're gonna wanna clean them out though, sure.
That's what I was gonna ask.
Yeah.
With all that
but you
download.
can
It's a
hit
fake
those
memory.
3 bars and takes you to your Adobe, page.
Okay,
and yeah,
thank you.
if you, where it does download is in My Files on your desktop there. And there's a downloads folder inside of here where you have all the, like the care needs and you can click on it and go down to multiple.
I'm about to clean things out.
Yeah,
We should probably do that.
but you can probably just hit the all button up at the top. I believe.
Okay.
And then this would take all the service notes or orders that you just opened in the PDF format. You'd get them out of your, and which I would think would speed up your tablet. I mean, I don't know how much space they have, but. I did want, the last thing I wanted to tell you guys is that we are aware of, especially in nursing, not so much therapy. Because therapy doesn't pull in as many care needs, they're not having as much of a problem. But for example, I'll bring up a patient, is this you now, James?
Yeah,
Okay, if you stop share.
there's a question from Lisa Vincelet, I think,
Okay.
regarding the downloads, something about Chromebooks. If you hit the one above it where it says screen, when you do a pop-up, it'll show the pop-up too.
For those of a Chromebook are still working from Kansas.
So
Yeah.
Chromebook,
Yeah,
can
you
you
have
use
to-
Chromebook only to access both at the same time? Yes, you can.
Yeah.
Absolutely. And there's no plan right now for us to take back the Chromebooks. So, bring your tablets into the patient's home because that's so easy. But if it's easier to chart at home on your Chromebook and go into Care Efficient that way, by all means do so. Is this what they're seeing right now?
Yes.
Okay. I wanted to show you guys something that we're aware of that is being fixed. Darrell brought it to our attention and Delia. So the nursing service notes on the tasks are, I'm sorry to say, very, what would be the right word? Jumbled.
Yeah.
So for here, this patient has a care need for tracheostomy, air clearance, incontinence, IV access, oxygen, all those different care needs. And what happens is, it's not supposed to be like this. It should have tracheostomy and then the interventions, urinary incontinence and the interventions, diabetes and the interventions. What's happening is the system is alphabetizing all of your interventions and not keeping them with the care needs. So this will be fixed. It'll be fixed sooner than later. It will have your care need in one, the title for your care need, and then the interventions that match that care need. And they were worried that the interventions here, that's still gonna be alphabetized, and when we wrote the care needs, we tried to write them in the order in which you would do them, just as a little like reminder of, like the wound vac one. First you do this, then you do that, then you apply this. So that is being fixed. This will not stay looking like this. So in case this has been driving you crazy, I am fully empathetic to that. And it's been elevated to someone at Care Efficient, and it will be getting fixed. Okay. I'm gonna close this and we'll see if we didn't answer Keena's question. And it was about IVs and where they chart. I'm gonna have to follow up, speak with the nursing leaders, and we'll get back to everyone on that. Are there any other questions?
We still have a question.
Okay.
This is still a discharge with Oasis. So once the patient's discharged, when she goes to open the visit chart and pick the service note, is she picking the non-Oasis DC? That's the question.
Okay, so you'd only pick a non-Oasis DC if the patient didn't
Hold on,
need.
Jennifer says they can't see. Sorry, I just saw Jen's click a minute ago.
Oh, so they didn't see that service note and all that?
So Jennifer, can you unmute yourself and tell us where we
Click on sharing at the very top left. You hit the screen right there.
Well, no,
That will, when you have a pop-up, it'll show that one. It'll show the pop-up.
I don't need, are they seeing this now or no?
Yeah.
Okay, okay, thanks, okay.
We weren't, can you hear me?
Yeah.
yeah,
Yes, you're seeing the screen now?
Yeah, we
Yes.
just can't see like when Jamie went to the nursing note.
Oh,
well,
so
we
they
should-
didn't, okay, and that's important. Let me just show you guys, sorry. So now I'm gonna have to do this, James, to share this part, because I'm leaving, right?
No, we see it.
You see this now?
Yeah.
They just said
Now
they-
we see.
Mhm.
Okay, thanks. I'll make this a little bigger. So I was talking to you guys about how, sorry for the people in the room who've already seen it. The care needs are being jumbled. They're not staying tracheostomy and all the interventions that go with tracheostomy, airway clearance and all the ones that go with that. They're mingling based on alphabetizing of the intervention. So you see it's A and then AD, AS, then it goes into E, then F. So this is a mapping behind the scenes Care Efficient thing that will be fixed so that you'll have the title of your care need and the interventions that go with that care need, the next care need and the interventions that go with that care need. So this will be fixed. Just wanted to let you guys know that. Okay, and then what was the question that we had?
Does she pick
Oh.
the DC Oasis?
So if the patient,
Non-Oasis.
no, you would all, if it's a commercial insurance, so if your starter care was a 5, 6, 7, or 8 on Move 150, like private insurance, under 65 years old, then you'd pick non-Oasis. But if the patient has, you did an Oasis on the start, if a patient either has Medicare or Senior Advantage or a Gold Coast patient, all those you need to pick Oasis Integrated Assessment. It should say like 9 dash discharge. Yeah, agency discharge.
But I feel for the patient that I'm trying to chart a discharge on, the only option is non-Oasis.
Okay,
There
so
isn't-
you haven't put the patient in their status is still active?
So let's do that patient. Jennifer, what's that patient's name?
Thomas Bates. I just did like when you demonstrated it, but it still wasn't an option after I put them in the discharge status.
So you do have him in a discharge status. Look,
Correct.
discharge,
So-
okay.
So,
So go to your calendar, start the
Mhm.
visit.
Did you start the visit on this patient?
I did, but let me remove what I already started because I only put the time in and then I kind of like.
Okay, so
start
we have
from
to
the
dump that for
beginning.
you because this has come up with some of the PTs. So what happens is you've added the wrong form.
So I'm gonna take it out for you right
So
now.
you hit the trash box. We dump it. And you should now be able to go back onto your calendar, home calendar, click on that bubble for that visit. You should get the prompt, the green plus sign that says add page service note. So let me know when you're there.
But we can do that.
Okay,
Okay, well,
All
but
right.
But I think a lot of people, well anyways, and then you should have the choice of 9. When you pick the Oasis, you pick Oasis Integrated as the type of assessment. And your choice for a 9 agency discharge will be there. And if it's not,
okay, discharge. Okay, so that is a different window now.
yeah. So if you guys are doing your discharge visits and the choice is only an Oasis choice of number 5, other follow-up, you didn't put the patient in the discharge status before, so you have to call somebody, stop right there and cancel. But if you move forward, you have to call into the office and ask one of us to trash that visit so you can start over. And it happens a lot and you guys will, it's just learning the process.
And to Lorraine Morrison, yes, you just go to the calendar and you hit cancel. Any other questions?
No.
I have a question on mileage.
Yeah, regarding this-
Patient have to be
so-
activated to your mileage?
Yeah.
Yes.
Okay, so I did a PT eval and a nursing did the start,
Discharge.
but I can't do my mileage because she hasn't activated the patient yet.
How'd you do
This one,
your visit?
sure.
Yeah.
Patient's not activated. Were you able to do your service note? Well, we need to know that patient because we need to talk to the nurse too to make sure it gets activated.
I sent her a click.
Okay.
Okay, we'll talk. Okay, so I think we can, thanks you guys, thanks.
We'll be
Thank you.
doing this, you guys, every Wednesday. And if you guys have questions during the week that are general, then we can address them.
So right now.
And,
it's
you know,
system-
Thanks for your
it's no
patience.
problem, but it's
We're
issue.
learning as we
I
go
saw
as well.
patient, But I cannot bill for.
I'm
this
gonna end the
visit
meeting
because
now.
I saw patient, but
Thank you.
I didn't send approval to PS department for review. Because I'm dependent of coder who's on the floor, but